Sports nutrition and top 20 exercise myths. Anyone who's on Facebook there following awkward gym moments might recognize my little guy down here. I'm going to be putting some little funny things in once in a while here. Kind of start off with some of them here. Billy has 32 candy bars. He eats 28. What does Billy have now? Billy has diabetes. Diabetes doesn't run in the family. The problem is that diabetes doesn't run in the family. The problem is no one runs in the family, correct? So, I didn't make it to the gym today. That makes 5 years in a row. If this is you, don't feel discouraged. It's never too late for fitness. It's actually, you talk to a regular gym person, it's better to start in February and March and let all the New Year's resolution people kind of cycle out of their little phase anyways here. That's right. This is one of my colleagues I graduated with down in Georgia at Life University, Dr. Corey Moat. He's in my quarter and everything. He's a chiropractor and he's a professional bodybuilder. And everything here, he's natural, did everything the hard work way, no growth hormone, no steroids, anything like that. I actually got in contact with him with this lecture to kind of get some material for this lecture and some research and that kind of stuff here too. Wow. Interesting fact here, Arnold Schwarzenegger, Mr. Olympia over here, trained with Franco Columbu. Franco Columbu was actually a chiropractor there too and adjusted a lot of bodybuilders and athletes in that there. My upcoming lecture in May, I don't have the exact time and date. It'll be in May. I could only book it 2 months in advance there. So more or less be towards the end of May is what I'm shooting there for. Addressing common female conditions. Every time I keep saying what my next lecture is, I keep accidentally saying female complaints. Female conditions, not complaints, female conditions. Following the lecture tonight, hopefully, if I have some time, I know we're cut short with the weather and that kind of stuff here. I'd normally like to go over a little Q&A with you guys here for you guys coming out here tonight. And if you guys got the certificates here, 25% off a first patient new appointment if you want to come out to the office and get more. Our lectures and other lectures are on YouTube here. The last few that we've been recording, better HD quality and everything, and I'm going to mention some of that stuff here at the end also here. DiverseHealthServices.com, we're going to be changing some things at the website here soon. One of the things here, our email newsletter, do not sign up for it because we're going to be dropping this. We got a GoDaddy and we're just not happy with them. I run the whole thing and just trying to get things situated them. It's just been a mess there. So I'm going to start a new blog here. We're going to be starting a blog here in another month or two so people could access it because we're just having a hard time with people signing up on the newsletter, getting it sent to them, and this stuff. And I just don't want to deal with that anymore. So we're just going to jump over to using a blog instead so people could all access it. You can find us on Facebook there. I think we broke 1,700 followers on there. We got people all across the U.S., Australia, UK. It's pretty cool looking at the demographics of who's following us on Facebook and where all our YouTube lectures have been going lately. You could follow us on Twitter. You could tweet us. Follow us on DHS or myself there. I like to kind of, instead of blabbing to all my Facebook buddies, kind of tweet more than blab to everyone else there. Skype, I love my Skype patients here. It's very cool. People who are getting nutritional advice from us and things that we've been able to help out with patients all across the world just through Skyping with patients here. And we look for good referrals elsewhere. We see so much of the same stuff that, we know how to treat it ABC and not kind of mess around with patients and, just attack it, man. This is a story you won't hear on your evening news tonight. 29-year-old female, left-sided muscle pain from head to foot, started after getting a flu shot. She got the flu real bad and now she has muscle pain. Some tingling in her left hand and foot, started on Valtrex, caused heart palpitations after having the flu shot. She had flu shots on the past and this one just kind of whacked her. This was last year's flu shot that she got. Now, this was interesting because they ran her through a CAT scan, an MRI, all kinds of blood work. They thought all her symptoms that she was having were mimicking MS-like symptoms. They thought she was having MS just starting on her. She works for a very reputable company. I can't mention the company name because I treat the president, I treat his wife, I treat his daughter, I treat a bunch of his family and coworkers now. After this case and how I fixed his daughter, they're done doing flu shots at their work. He thought he was doing a good thing for his company, saying, okay, you know, I'm going to do free flu shots and get you guys all situated, this and that. And I got to say, with what I put her on, there was a little bit of luck involved with this too, because I can't always turn these patients around with what she had going on. On top of what I put her on, some of the left arm numbness was from her neck there, but all the other symptoms were internal issues from other things. I cleared her up 100% with all this stuff, and she's doing great. Very, very cool. But do you know what makes the flu deadly? The media. Period. So all I'm going to rant on about that. The number one preventative thing of the flu is vitamin D. No one gets sick with the flu during the summer because we're all out in the sun and our D levels are up. 5,000 to 6,000 IUs is the adult daily dose of vitamin D. If you're going to do higher than that, you need someone watching your blood work and monitoring that there, and someone who knows what they're doing with that. IAG's another powerhouse thing I've been using this winter. Arabinogalactulins here is an immune modulator. To really put this in perspective, echinacea, the component that works in echinacea, is 6% arabinogalactulins. IAG is 99% arabinogalactulins. These two things that I've been doing this year, this is the first winter in my entire life, and I'm not lying up here, that have gone this far into the winter season without having one cold or immune issue. My wife's been sick once or twice. She's not doing all of this here herself. She's doing a D. But even being around her, with her being sick, I didn't get sick. And I absolutely contribute to these two products I'm on. And since I'm bragging about it so much, next week I'll probably be sicker than a dog with the H4N5, pneumonia, bird flu, crap in my pants and everything there. Talking about that, Ron, just raise your hand here. Gallstones can be passed. November to January, I treat gallbladders all the time. Gas, bloating, indigestion going between loose and tight stools, burping, belching, gurgling in the stomach, bloating, stomach issues. Pain in the center, to the right, to the shoulder blade here. Your doctor and MD will tell you, you can't pass gallstones. That's impossible. The proof's right here. There's a dime right there. This is actually a toilet lid here. I had to literally crop the crap out of here, so to say. So, unless we ask you to send us this stuff, don't send it. But if you really want to send us what you're passing in the toilet, send it to info@Diverse Health Services and flag Dr. Tent's name. So let's get into it here. Who's deficient in minerals? This is my talk to the Detroit Lions, well, maybe not the Detroit Lions, I don't know if anything could help them recently. Detroit Red Wings, the Tigers, any athlete, period. This is a world map right here. Get to the next slide. North America. 85% of our soil is depleted of minerals. If the minerals aren't in the soil, it's not in the food, it's not in us. I don't care how good you're eating or how crappy you're eating. If the minerals aren't in the soil, it's not in the food, it's not in us. These are why all these athletes today rip, tear, pull, broken this, out for the rest of the season. Period. It is simple as that. You're not using the right minerals, whole food products, not your synthetic cheap vitamins. Your body won't hold up. Here's a prime example. You guys who watch UFC stuff, Anderson Silva, who broke his leg here, pretty nasty break right here. This was just last month here. Darker skin, vitamin D deficiency, sweating out more minerals than you're getting in your diet. This is how you break a bone that easy being a supreme athlete. Absolutely, without a question of a doubt right there. Getting another mineral deficiency that's pretty prevalent, especially in the northern states here, iodine deficiency. Dr. Brownstein, who's been working with iodine for the past 2 decades, has found that 95% of his clients that walk in his office are iodine deficient. He works a half hour away from us here. 95% of the patients are deficient on iodine. Why is this important? Well, things like chromium, bromide, fluoride all push iodine, and caffeine will push iodine out of your system. Hypothyroid issues, which are correlated to a lot of weight issues in the north, are correlated to iodine deficiency problems. Lumpy, bumpy, cystic breasts, cystic ovaries, things I'm going to talk in my next female lecture are highly correlated to iodine issues. We're cooking indoors more versus outdoors. Teflon pans, fluoride that comes from that stuff will turn off your thyroid. Showering in the chlorinated water, brushing your teeth with fluoride toothpaste, all this stuff pushes iodine out of your thyroid and can affect metabolism rate and weight issues here. Simple stuff. I just switched over to ceramic pans a few weeks ago. I tell you what, you cook once with a ceramic pan, you don't ever want to go back. It's very, very cool. So, myth 1, if I lift, I'll only get bulky. Well, the truth is, lifting weights burns fat and builds lean muscle. Lifting weights, heavy weights at low repetitions is more for bulking, whereas lifting lower weights and doing high repetitions is meant for toning. Now, if you put 5 pounds of fat compared to 5 pounds of muscle, what looks more bulkier to you? The International Society of Sports Nutrition's position on creatine. It is its position of the International Society of Sports Nutrition that the use of creatine as a nutritional supplement within established guidelines is safe, effective, and ethical, despite any myths and other things that you've heard otherwise. Now, this is interesting. This is more for the younger guys here. I get a lot of patients that ask me about the use of creatine. I've used it in the past. I haven't had problems with it. Some of the guys who talk for other companies, biotics research and stuff, they're not big on it there, but there's no clinical and research evidence to support it not being safe. So people who want to use it, it is safe within guidelines there. It's all about your goals and things that are involved with your workout here. Myth 2, as long as I'm moving, I'll burn fat. If you're moving at a snail's pace and your goal is to lose weight, it isn't going to happen. Target heart rate zone must be 50 to 85% of your max heart rate to burn fat. Now, I got a chart on the next slide that gives kind of a range of where it should be for your age there. If you Google target heart rate, you could actually get a little bit more of an exact thing for your age and whatnot there. Myth 3, cardio is the best way to lose fat. Steady cardio over 30 minutes increases cortisol in your system. Now let me explain this here. If you're doing like an in-between run or an in-between jog to run, and you go past 30 minutes, you start tapping and pushing into cortisol and raising your cortisol up. Raising your cortisol, you'll have a harder time losing weight in those trouble areas. High intense interval training is much more beneficial for fat and calorie loss here. Interval training is going to be doing cardio about 15 to 25 minutes. You go 2 minutes hard, a minute slower, 2 minutes hard. It's kind of like sprint training, things like that. You can get the heart rate up, and you go back and forth. You can get more benefits out of high intensity interval training there. And after a high intensity cardio workout, you'll continue to burn more calories long after you're out of the gym there. So they talked about doing a lot more of the cardio in the morning because you burn and get that metabolism going for the day there too. And I'll talk about some of the times and things that people kind of work out here. I want to throw this one in here too. Hey, what do you do for exercise? I lift weights. What do you do for cardio? I lift weights faster. This is a meathead kind of comment, but kind of thought it was funny, so I had to throw that one in here. Like I said, this is from Awkward Gym Moments here on the Facebook thing here. This is interesting. Dirty electricity elevates blood sugar. Dirty electricity generated by electronic equipment and wireless devices is widespread in the environment. Exercise on a treadmill, which produces dirty electricity, increases plasma glucose. These findings may explain why certain people with diabetic issues and blood sugar handling issues have a harder time controlling this. Now, I got a guy that is a personal trainer up the road over here, about 10 minutes in Novi. he does not have any plug-in electronic equipment in his office or in his building because of this one factor. He says, everyone that comes in my building for working out, I check them with the fat caliper, which I'm going to talk about a little bit further on, where you park fat at and stuff like that. He says, everyone's got cortisol, insulin, and glucose-like issues. And he's like, I don't need this in here, elevating this and causing any elevated problems with this here, which is interesting. I'll use more of a row machine, jump roping, sprinting. I will do things outside of, or a spin bike, something that is not plugged in, to avoid this. There's a lot of issues causing insulin-resistant type problems today there, and you don't need this extra electricity thing being electrically charged kind of bothering you. We're swimming in a sea of Wi-Fi today, cell phones and all this kind of stuff. It's becoming an increasing prevalence problem here. Myth 4, I have to exercise at least an hour for any benefit. The truth is absolutely not. More importantly, it's more what you're doing, your exertion level, and the overall structure of your training plan. Example, CrossFit. CrossFit's more of a smaller workout as far as more intense, shorter term things. Great workout and all. I'm not going to say anything bad about it. There's some people who are on the fence about the CrossFit workouts there. The only thing I'm going to say, some people tend to think that they're a little bit more of an elite athlete than what they really are, and it's not structured for them. They need to scale it down quite a bit more to get that workout. But from a chiropractic standpoint, when you're going all out at these workouts and going fast, your form slips up and you get lazy on your form, you're more susceptible to injury. That's the only thing that I got to say about the CrossFit. Other than that, I work with a bunch of different guys with the CrossFit stuff, and it's a great workout. I've done the workouts myself there. But the injury stuff, you just got to be a little bit more careful with on some of that stuff there. Eating protein will only make me fat. False. The standard American diet is what makes you fat. Higher protein diets and lower carbohydrate intake has always kept people trim. Period. This is, you look at the Atkins, you look at South Beach, all these different diets. It's this next slide that I'm going to really explain this here. Here's how you live on a daily basis. You break down proteins, carbohydrates, fats, period. Proteins on the amino acids, carbohydrates on the sugars, fats, fatty acids, and glycerol all go into the Krebs cycle to produce ATP, energy. So the standard American diet, which is so heavily driven on carbohydrates and sugar, you really break this pathway down. Sugar goes into glucose, your blood sugar. To get glucose into your cells to produce ATP, energy, you need something called insulin. Now, all the sugar you're getting in the diet and everything's sugar-coated today, you're overusing the insulin cells. What you don't use glucose for energy, you store the rest as fat. So the standard American diet, we're constantly more in a fat building mode than we are in a fat burning mode. That's why if you take that extreme of this and you say Atkins diet, you cut out carbohydrates and sugars, you go right to fats and proteins, you can completely change your metabolism to a ketogenic state there, and you get in a fat burning mode. Now that's the extreme of that there. Just kind of explaining why the higher protein, lower carbs and sugar diet kind of works here. And a ketogenic diet, and I don't agree with these percentages here. This is just an example, fat and protein, fat and protein. 2 people I'm going to put on this diet, patient-wise. Cancer patients, I'm going to put it all on this diet here because you'll starve them. You'll starve the cancer. You starve someone with sugar, you starve the cancer. Cancer feeds sugar. I talked about that in my Cancer Killers lecture. Second person I'm going to put on this, people having seizure issues. A ketogenic state, ketogenic diet in seizures respond phenomenally with knocking a ton of those out there. The 2 types of patients I'm going to put that on. Now that percentage, so leafy greens and whatnot, your cruciferous vegetables, needs to be higher, but this is just an example of a ketogenic thing. I just want to throw that up here. Obviously, I don't agree with just 5%. Now you talk to your typical MD and everything, well, you can't eat fat and protein. That's going to make your cholesterol go up. So a low-fat, low-protein diet is essentially a high-carbohydrate meal. High carbohydrates is one of the things, I should say, that made everyone balloon out. So new guidelines may widen the use of statins. People between 40 and 75 years of age with an estimated 10-year risk of heart disease of 7.5% or more will be advised to take a statin. The new guidelines could double the amount of people on medication to lower the cholesterol, as experts say. This was just the other month here. So if this doesn't scare you, it really should. Look at all the seniors today. Overuse of statins, artificial lowering their cholesterol, dementia, Alzheimer's. Whew. Your brain goes right downhill if you follow these recommendations to keep artificially lowering your cholesterol. On top of it, it sucks the CoQ10 out of you. And Lipitor is the top revenuing drug in the United States, but you all should trust your heart to Lipitor because that's what the commercial says. Mainstream media attacks multivitamins, and when they use vitamins that are cheap, low-grade synthetic vitamins with inorganic minerals in them, you won't digest them and you'll get crappy results. And I'm sure this study was probably put on by a big pharmaceutical company here. And they were all over this stuff on the news about a month and a half ago here. And it's ridiculous here. This is the same media that tells you to get a flu shot. 3-4 people died in Michigan here with this kind of stuff here, and 36,000 people will die a year of the flu in the United States, and 500,000 people will die worldwide. They've had the flu shot around forever. If I had more time, I'd write on that board here and really break that down. But what's unique to this flu shot than the previous ones? There's genetically modified components in this year's flu shot than there was in the past. So I got some other interesting facts and things I want to talk about further on. People are fed by the food industry, which pays no attention to health, and treated by the health industry, which pays no attention to food. Do you think this is going to get any better? You got politicians in office right now who were fed money to get in office from Monsanto company, who poisons our food to get the politicians in office, and when they're in office, they protect them on the other side. This is not going to get any better. The effects of protein timing on muscle strength and hypertrophy. This was pretty interesting because this is kind of debunks something I thought here. Current evidence does not appear to support the claim that immediate consumption of protein pre or post workout significantly enhances strength or the hypertrophy of the muscle here. I thought this was interesting because I was always under the assumption, well, if you work out, you got to rush home and get that protein shake in you, that hour window span. Surprisingly, they don't support it there. I thought that was interesting because I was under the belief I will still do a protein shake an hour before my workout there. I don't want something heavy in my stomach, but I still want my blood sugar stable and whatnot. And I'll be talking about different proteins and whatnot afterwards. Glycogen repletion is one of the more important things here too. The primary goal of traditional post-workout nutrient timing recommendations is replenish glycogen stores. Glycogen is considered essential to optimal resistance training performance with as much as 80% of ATP production. And when I work out, I'll use a recovery drink there, depending on the type of workouts, and a lot of those recovery drinks are more sugar and simple sugars based to break down and restore those glycogen stores in your muscles faster versus more protein based. But the one I do use, I'd say maybe it's like 20% protein, 80% more simple sugars for more of those intense workouts there. And there's different things, and if you're doing intense workouts and jumping in things, a good recovery drink does work phenomenal there. And there's other things you could do here too, and there's patients I've treated. When I get into big workouts, I like to use the bioanabolic pack through Biotics research here. It's got the probiotics, amino acids, chlorophyll, B vitamins, glandulars. Depending on your goals, you could obviously work on different things here, and I'll talk about different protocols that I'll use with patients, whether it's an insulin thing, cortisol thing, or energy type thing. It's every cool ways of customizing things specifically for you. I'm a big component of the paleo diet here. Just breaking down the food chart here in pyramid: nuts, fruit, vegetables, meat, eggs, fish. Now, the big three things of the paleo diet: you cut out your sugars. We talked about sugars. It's wreaking havoc on everyone. It's completely abusing the United States here with the standard American diet. You cut out your grains. I'll be talking about what's wrong with today's grains further on in the lecture here. 3, you cut out dairy. Why do you want to cut out dairy? Well, if you want to lose any ounce of weight, you won't be eating dairy, because all the estrogen, steroids, bovine growth factors, and things are in today's dairy. You will not lose an ounce of weight eating today's American dairy, period. I had 2 kids. I've always talked about this at my lectures there. 2 kids, 14 years old. Yeah, about 14 years old. Both had some thyroid issues, but the one kid loved milk. The other kid hated milk. The one kid who loved milk drank 2 gallons a week. The other kid didn't drink any. He had an easy 40-pound difference on his brother. Got milk. Breast cancers, ovarian things I'll be talking about in the female lectures. That just feeds that stuff like wildfire. Myth 6, morning is the only effective time to train. The time of the workout isn't as important as to be more consistent. People with elevated cortisol levels are better off working out in the mornings, though. And here's why. You look at a cortisol chart here. Cortisol is highly elevated in the morning to get you going, and it tanks more at night. Now, the people that tend to have elevated cortisol in the evening, cortisol's more up here, they're wired. They're wired, and they can't calm their system down, and they have a hard time falling asleep and sleep issues. You get the weight gain issues and things of that nature there. People that have the issues with cortisol that doesn't completely go up all the way in the morning, these are the people that get dizzy from sitting and standing. These are going to be more the issues with the people crave salt, have low salt levels on their blood work, or they love caffeine. They love their stimulants because they're trying to artificially push their cortisol up with stimulants because their cortisol is off there. This is important to kind of understand this here, because when you talk about the morning versus afternoon workouts, there people who are doing too much intense workouts, pushing that cortisol level in the evening, can kind of throw off that cortisol thing there too. Now, the stand on caffeine here, the scientific literature associated with caffeine supplementation is extensive. It's been shown that caffeine supplementation in the range of 3 to 6 milligrams can significantly enhance both endurance and high-intensity performance in trained athletes. And to break this down, 1 cup of coffee is 100 milligrams of caffeine. If you play with fire, you'll eventually get burned. If you got cortisol issues, any stimulant, ephedra, caffeine, things like that, will tax and toll your adrenal glands. I'm not for it, but the literature says it's perfectly safe here. Now, the Olympics are next month here. Now, when you look at the Olympics and athletes with training and stuff, they say that 12 milligrams in 1 milliliter of urine of caffeine dosage is considered doping. So if that puts anything into perspective here, you go to the next slide here. Look at different caffeine milligrams in these different types of things here. 1 cup of coffee is 100 milligrams here. Just kind of go up the chart here. Look at the 5-hour energy here, Full Throttle, the Rockstars, the Red Bulls. I've had people that have artificially had heart and cardiac issues by pounding too much caffeinated beverages. Now, caffeine's an artery constrictor. People that do too much of this stuff, they're going to get issues with tightness in the left side of their chest because this constrictor is like a coronary artery constrictor. You're cutting off oxygen to the heart. When you're working out, you want oxygen optimization. You want to be oxygenated. You want things that dilate your arteries and get the oxygen to the muscles and throughout your body versus things that constrict your arteries. Keep that in mind there. This is whey isolate and this is whey concentrate here. There's a difference. Concentrate's the whole form, the one that you want there. People go back and forth on, which is better, which is more for me. Protein isolates are proteins stripped away from their nutritional cofactors. Most isolates are exposed to acid processing Your body cannot assimilate proteins in isolate form due to overprocessing. Isolate forms are deficient in key amino acids and nutritional cofactors. This is like whole food supplementation. Do you want vitamin C, the real vitamin C and all the cofactors, or do you want 1,000 milligrams of ascorbic acid and say, here, you got vitamin C right here? You want the whole thing, not parts of things. Whey protein, I do whey all throughout the winter here because it's rich in branched chain amino acids, fast digesting, boosts glutathione. It's a huge, that glutathione component is a huge thing for your immune system here. People with gut issues, that whey protein, the IgG component, and other factors help heal the gut lining, and a lot of people there too. But there's some people that have issues with dairy and stuff. If you have issues with dairy, gluten or the whey is normally not too bad. I stay away from milk and ice cream. If you know your immune system, if you're more bacterial related, you're going to stay away from the milk and the ice cream. If you're a viral person, you're going to stay away from foods high in arginine because that feeds that virus there. If you're a fungal yeast person, sugars feed all that kind of stuff here. So knowing your immune system is everything, and there's different options for proteins here, but I like to use a clean whey. I'll explain what a clean whey is. Now, people that get this delayed onset muscle soreness, branched chain amino acids combined with taurine here could help alleviate that. Literature supports using those two together. I have some patients just using the branched chain amino acids there and trying to get some results with that. And sometimes it works good by itself there, but the literature states if you want to, that soreness in your muscle after working out, if you want to help metabolize that out, that combination works pretty good. Personally, I see in the office here a lot of patients that will have thiamine and B vitamin deficiencies. Thiamine helps metabolize lactic acid out of your muscles. Now, lactic acid is when you're working a muscle out and you're feeling that burn, that constant burning. You got to stop because it just burns. Now, people get this achiness muscle issue, and sometimes it's not just correlate, just the, I need a protein shake or I need branched chain amino acids. It's more of a B vitamin deficiency, and I could look around, I could scroll a room, I could feel people's pulses. Too many refined carbohydrates, sugars, carbs, sweets, all drain your B vitamins. Your B vitamins aren't things that you store in your diet. They're water soluble. That's why if you take a potent B vitamin, you pee out bright yellow, orange color because you don't store it in your body there. So if your diet's more of the standard American diet and the food's very weak, the biggest three deficiencies we're going to see in our office, thiamine, magnesium, and zinc, the top three there. And B vitamins are all right in that whole category there too. Too many sugars, carbs, sweets, you'll drain that right out. Some people get weak pulses and things of that nature, or a fuzzy coated tongue is issues. Tongue and cracks in your mouth are issues with B vitamins and not, being deficient on them there. Now, if you got issues with whey, dairy, gluten stuff, Garden of Life is another protein shake that we use in our office. It's rice-based protein. It's gluten and dairy-free. Phenomenal stuff here. Because we do run a lot of food sensitivity panels on a lot of patients, and I'll talk about that further on how that could contribute to weight issues and hold you back there, because a lot of the food allergy today are increasing people's cortisol and they don't even know about it here. Commercial brands of protein. Here's the simplest thing. If you got to go to GNC and it takes a scientist to read the back of the label, you probably don't want it in your system. Simple as that. How good's your whey? Is it GMO free? Is it genetically modified free? Is it cold pressed, acid free processed? Is it all natural pasture fed cows? Is it concentrate versus isolate? Heavy metal free, artificial sweetened, free of soy? These are the questions you got to ask to see how clean your protein is. I trust one off-brand company that we use. Every other brand I use is professional line of protein there. Artificial sweeteners, I got to remind people once in a while here. Aspartame. This is just a portion of side effects of aspartame. I've seen patients come in our office with artificial seizures and artificial strokes activity that were all side effects of aspartame. Dr. Russell Blaylock, who's a neurosurgeon, very reputable neurosurgeon, says these are excitatory toxins to the brain, and these are the things that it could cause. This is in everything, your gums, your certs, all this stuff. Diet Cokes, Diet Pops, everything. Pay attention, and this is the problem that people get tripped up on when you say, you need a no sugar diet. No sugar diet doesn't mean jump into doing Splenda. And Splenda's chlorine based. That'll kill off all your gut flora on your gut there. You don't want this stuff in your body. It'll cause more harm than good. Myth 7, stretching before workouts is necessary. A study being published in the Journal of Strength and Conditioning Research concluded that if you stretch before you lift weights, you may find yourself weaker and wobblier than you expect in your workout. What's interesting about this is, I've gone back and forth. If you're doing, workouts and heavier weights, I really don't jump into doing a lot of stretching for those workouts. But if I'm doing more plyometric type stuff, I'll do a warm-up session where I kind of break a little sweat. Then I'll go into a stretching session, and stretching more or less kind of gets the blood to the bigger muscles and whatnot, and will kind of help prevent some injuries. But the research says if you're doing more of the weight stuff, that it's not as necessary as what a lot of people thought there.
May I have your attention?
And I added this here. There's a fine line. Too much flexibility equals instability, and not enough flexibility could go right into injury there too. So there is a fine line between someone who's over flexible and under flexible there too. If I eat less often, I'll lose weight faster. I hear this from the guys. I just go to the gym here because I want to work out and so I could eat like crap. I kid you not, these are some of the things I hear. Eating less will slow down your metabolism and your body will go into survival mode, which can create cortisol problems. Stabilizing your blood sugar will prevent going into eating binges and speed up your metabolism here. Now, I'm going to be talking about some cool things. Intermittent fasting that I've just got involved with this. Pretty cool. There's a difference between starving yourself and doing certain fasting type things here. But if you got hypoglycemic issues and tendencies towards that, you got to be more attentive to your blood sugar stuff. And that's why we preach higher protein, less carbs and sugars, because the proteins have the amino acids which stabilize your blood sugar from doing the roller coaster effect. Your blood sugar and your moods go hand in hand. Too many sugars, carbs, sweets, up, down with your blood sugar, and your moods will go hand in hand. All these kids that can't focus today, half the ones I see, I just got to treat their blood sugar more than anything. Food is the most widely abused anti-anxiety drug in America, and exercise is the most potent and yet underutilized antidepressant. That is so true. All the studies, and the ones will keep popping up from time to time, exercise has done better than any antidepressant on the market, period. Exercising releases all those feel-good endorphins. Now, the people that struggle the most with depression and this, seasonal affective disorder stuff right around this time of the year had the serotonin issues. Changing out your lights to the full spectrum light and get that bright white lights. Exercise. Simple things like that will go a long way. Now, fitness is 20% exercise and 80% nutrition. You can't outrun a fork, and that's so true. A personal trainer would probably even tell you otherwise. Losing weight is 10% exercise and 90% diet. Is absolutely true. I've had, there's a lot of people that, here's an interesting fact. If you got a cortisol issue and you're in a gym, the people that say, I work out, I'm tired, and I work out, and they're like, I don't feel good after I work out. I feel more tired. I feel more down. I can't get through my workouts. You're trying to push through a cortisol problem. That's what my cortisol people come in and tell me. I treated a lady. She just came in 2 weeks ago, put her on 2 supplements for her cortisol, did nothing outside of changing what she was doing. She dropped 10 pounds, doing nothing but just addressing her cortisol stuff. Salt is bad for me. Table salt, sodium chloride, is refined, pure white bleach and doesn't have the mineral content like Celtic salt does. Celtic salt is dirty gray and has the minerals to it. That's the salt you want. Hypoadrenal gland issues, patients that have issues with hydration will need more salt. People that got issues from dizzy from sitting to standing will have this salt and adrenal gland issue. Well, I'll see more of this issue with patients during the summer because you'll sweat out all of your salt. Water is the only thing I need for hydration. The majority of people working out will do fine with water there, but dehydration is very common and goes heavily missed. Thirst is commonly misinterpreted as hunger. Coconut water is a great sports drink for those in greater need of electrolytes. I've got patients I'll do coconut water with, and I'll have them do salt pills. I'll talk about another case here a little further on here, but if you work out too much and you lose your salt, you won't hold your water. You go to the hospital, the IV bags are 0.9% sodium chloride and dextrose, so you get all your hydrating factors from the IV. In third world countries where they don't have the medical necessities like they do here, they'll give people IV solutions of coconut water because it hydrates and mimics blood that good. Pretty interesting fact there. You're not hungry, you're bored, drink some water, learn the difference. Your brain, hypothalamus, hunger, and thirst are in the same centers. A lot of people are dehydrated and don't know. It's sometimes even easier to get dehydrated during the winter than it is during the summer. If you don't have enough good oils on your skin, kind of like oil on a boot. Guys put oil on their boots during the winter so it doesn't crisp up and get hard. We dry out and get dehydrated very easy being indoors all day long. This was a 26-year-old girl. I had to put this up. She just was in last week. It was a pretty cool story here. 26 years old. If I had more time, I'd pull someone up here and show you how I muscle test to pinpoint what I did exactly with her, because this was a really cool case. Trouble breathing while sitting or moving around, comes and goes, zero cough, possible allergy to her cat. She had some hives going on here too. She was a CrossFit girl working out 5-6 days a week. She goes, everyone is running circles around me. I can't breathe. Something's wrong with my heart, and I'm scared. That's exactly what she said. Some simple muscle testing stuff. I go right to the salt reflux. Weak on her salt reflux. I go, you sweating like a dog with these workouts? She goes, yeah. How do you know that? I go, your salt's weak. And I went through her heart reflux. Her heart was weak. Turn off her heart valves, checked her heart valves, checked her for a heart virus. Muscle test, simple applied kinesiology, contact reflex analysis, checking her heart. She cooked her heart and lost her salt. Put her on 2 things. She comes back 2 weeks later, 90% better. I could breathe, my hives are gone. I can't believe what you did. Now it's cool just fine-tuning and tweaking athletes. Just some simple stuff. That was a very cool case. I told her I was going to talk about her case here tonight. Doing abdominal workouts will help me get a six-pack. Core muscles consist of more than abdominal muscles. You got your abdominal muscles, you got your transversal obliques, and your back extensors there. The truth is, you need 6 to 12% body fat in order to see abdominal muscles. If you're above that, you could do 200 sit-ups a day in and day out, day in and day out. It's more getting your body fat percent down to see your abs than it is doing abdominal workouts here. Intermittent fasting, this is what I want to talk about. This is pretty cool. I've done some research over this last 2 years before jumping into this because I think it was just a kind of a fad thing and whatnot here. It's a type of diet scheduled eating plan where you simply restrict your normal daily eating to 6 to 8 hours window of time, not cutting your calories or anything like that. Very cool, and it increases your insulin and leptin sensitivity there. And I've done it for about 2 weeks, and it's really cool. And when you jump into something, 2-3 weeks into something, it becomes a chore when you got to babysit your meals and cook certain things, and you get burnt out eating the same things. When you're cutting out and fasting through a certain part of the day, it's really easy to get through this, and I thought it'd be a lot more challenging than what it is. This is actually pretty simple here. You get more in the fat metabolism here, and you decrease your triglyceride levels, inflammation, and the weight gain issues and the metabolic stuff as far as the diabetic stuff decreases there too. There's some gray zones because some people say that this increases growth hormone naturally in there too. It's kind of a bit of a gray zone if it really does or not there, but I found incorporating this has been pretty cool. This is from Dr. Mercola here, and kind of showing you what an example schedule looks like here. So you eat 12 to 6 p.m. You fast everywhere else. It's kind of cool because I'll fast, and mornings are easy for me to get past. The evening I'll struggle a little bit more there. He recommends doing a workout regimen right before the thing. It's kind of in the middle of the day. It's kind of a tough thing. Only thing, I'll show you what my schedule is and how I've kind of changed it around a little bit. But you could pick the 6 hours. Now, this was based off the 8-hour diet book here. And I forget the author of that book, but he talks all about intermittent fasting, and he arranges it. You could do it 6 to 8 hours. But I didn't want to put up the book because I don't completely agree with the things he was talking about, because he says you could eat whatever you want, eat garbage, this and that. And you know, your stomach's going to shrink. You're going to optimize nutrients quicker, still eating that 6 to 8 hour range there. You obviously want to eat healthier choices of foods there, especially if you do more of a paleo style or ketogenic type diet. You'll get in a faster fat burning mode more than anything there. You don't have to go extreme Atkins or anything like that, but I like to pick more paleo style diets throughout the weekdays when I do stuff like this. And quick tip here, remember you're not supposed to starve yourself. It's not even supposed to require that you restrict the amount of food you take as far as calories and whatnot, but you want to eat healthy fats like coconut oil, olives, butter, eggs, avocados, and nuts. Eat healthy fats. Healthy fats. Your brain's half fat, half cholesterol. Lean fats, lean protein feeds your brain. Period. My intermittent fasting schedule, I got it around, I'll eat between 12:30 and 6:30 p.m. I fast 18 hours after 6:30 p.m. there, and I rotate my days of training between circuit training and high-intensity plyometric interval training. I fast into the days of working out, but not through them. So if I'm going to work out, say I'll fast into 12:30, I'll eat normal, and then have a workout, and I'll still eat afterwards. Then the next day, I'll jump on going back into the fasting stuff. Pretty easy, pretty cool. Research if you're interested in something like that. It's pretty easy to incorporate that in a regimen there. Low caloric intake here and longevity. This is from Life Extensions. They did a study based off of 3 animal kingdoms of life, cutting down calories and longevity increase. It's pretty interesting. Now, this was an animal-based study, so they're implying that there's a growing body of evidence suggesting that caloric restriction may reduce disease risk factors, which may have a direct influence on health span and indirectly increase lifespan. Effect of exercising while fasting. This is from the Journal of International Society of Sports Nutrition here. Findings suggest that endurance exercise is an excellent adjunctive therapy to alternate day fasting, as it leads to positive behavioral changes that may lead and contribute to long-term steady weight loss. And keeping the weight off, that's one of the big problems that a lot of people have, is keeping the weight off there. Now, insulin resistance. What is insulin resistance? It's burning out those insulin cells in your pancreas, too many sugars, carbs, sweets, increased cholesterol, low HDL, that's your good cholesterol, high bad cholesterol, LDL, increased triglycerides, increased glucose, and your diabetic factor, HA1C, and increased insulin. Also under this should be blood pressure. Blood pressure will go up there too. I had that backwards. It's hemoglobin A1C. That's why I kind of jumped on that there. There's just a diabetic factor on blood work there. But these are all the different things here that, if you have one of these that run up, this is insulin-related issues. And these are one of the things that I address as a functional nutrition, certified functional nutritionist here. Myth 12, drinking diet soda will not make me fat. One large study found that people who drank artificially sweetened soda were more likely to experience weight gain than those who drank non-diet soda. Diet sodas trick your appetite centers in your brain. This goes back to the hypothalamus here. Artificial things in there. High fructose corn syrup, MSG, all these things trick your appetite centers here. Diet sodas don't have calories because they don't have any nutrients, period. Stay away from it. Now, dead nutrients. Alcohol. Alcohol is indirectly fattening because we tend to all eat the wrong things after we've been drinking. And talking to the guys about this stuff here, alcohol, especially beer, is an aromatase inhibitor when you should be converting more testosterone in your body. Alcohol, and mainly beer, prevents you from converting that testosterone. It will convert more into estrogen. And you convert more of the estrogen, you get more of the belly and the chest problems going on there. And I'll talk about that on a further slide here. GMO foods, the Europeans are so far ahead of us on this subject here. When you feed rats and things 100% genetically modified foods, weight gain, tumors, disease, all follow that. This is why you cannot find GMO foods in Europe that aren't labeled. They all have to be labeled if they're in their country. Now, I put this up here for a reason. I'm going to label this specifically. American beers are going to be full of your genetically modified food substances, your corn syrup and all this kind of stuff here. Have, a 6-pack of American beer one weekend. Do a 6-pack of a Heineken another weekend. And feel the difference on your gut. European beers don't allow the crap that we allow in our foods here. Genetically modified foods are tearing up people's guts today, and wheat and this stuff here too on top of the corn stuff here. It's a night and day difference if you have an American beer versus a foreign beer. Now, this is the chart of the top 10 genetically modified foods here. Wheat is going to be climbing right up in here too. This chart was from the movie Genetic Roulette. You could Google that movie if you're interested. This explains why there's so much irritable bowel disease today, Crohn's, ulcerative colitis. Since the mid-90s, since they've increased genetically modified foods, all the rates of irritable bowel disease have gone through the roof. All this Roundup Ready food, if an insect eats genetically modified substance from a plant, it goes to the stomach and blows up there. If we eat it, it's supposed to be safe for us, yet since they've incorporated this all in the food here, all these gut issues have gone through the roof. Do you really think that God gave us a body that we can't digest food, that there's so much more gluten and celiac today than ever before? It's not us, it's the food. We were not meant to break down geoengineered lab food, period. Ask a foreign person. They don't have the gut issues in their countries like they do here. Canada and US, everywhere else, you don't find the GMO foods. This speaks volumes. It's got to be labeled. Why is it going to struggle to be labeled in the US? Well, the Monsanto company fed all the politicians to get him in office so he gets protection on the other side. This is why it will be a struggle. The peanut epidemic here. Derivatives of peanut oil are in your antibiotics and vaccines. This is why there's a growing increase rate of kids at the peanut table, the no peanut zone in schools. If you put peanut antigens in your bloodstream and you build antibodies to it, when you eat peanuts, those antigens attack your gut or attack wherever and create this anaphylactic reaction. This is why there's a growing rate of the peanut problem here. Myth 13, being female, there's no reason to be lifting weights. Wrong. Benefits: increase physical strength, lose body fat, prevent osteoporosis. speed up your metabolism, and prevent body injuries here. Carbohydrates are bad if you want to lose weight. No, simple carbs are bad because they spike your blood sugar too fast. You want complex carbs to stabilize, that are more slow burning to help stabilize your blood sugar there. Carbs give you energy for your workout. If you're cutting out all your carbs there and you try to work out, you're going to struggle. Muscle turns to fat. Just as fat can't transform into muscle, muscle won't transform into fat. Building muscle and losing fat are two completely different processes. The formula: in order to gain muscle, you must consume more calories than you burn, and in order to lose body fat, you must burn more calories than you consume. It's as simple as that. Now, you got cell phones and whatnot. You might want to take a picture of this next spot here. This, where you park body fat at, tells you everything. This is where I come in, and this is how I treat patients that come in the office that want to attack weight issues and stuff. This is a male body. If you've got arm fat going on, this isn't I need a shake weight type thing. This is issues with insulin or low DHEA type things. Chest stuff, estrogen, insulin, low testosterone. A lot of body trainers are personal trainers and stuff. They'll use fat calipers, and they could tell you, where your trouble areas are. If it's more of an insulin issue, if it's cortisol and whatnot, growth hormone, those types of things. We are living in a sea of estrogen. I can tell you right now, estrogen is a huge problem because it's the plastic. It's the plastics, the tap water, all these chemicals getting in us are all mimicking estrogen problems today. Females, a lot of the same zones kind of show the same things there. Triceps, the insulin, the low DHEA, chest with the estrogen and stuff here. Very common things here, and very cool because the guy that I was working with, the personal training up the road there, he measures all these things, and he'll address them with patients to try to get them over the hump. If you got a cortisol issue and you're trying to jump in a workout regimen, you're tired, you can't keep going, you're trying to push and push, and you're working against yourself because you got a cortisol problem. You do this battle, cortisol's up, then you run into the insulin resistant type problems and that. So you got to address it properly there. Now, the different body types: ectomorph, mesomorph, endomorph. Just to get in a quick description, genetically gifted athletes tend to be mesomorphs. The problem with a lot of people that tend to have issues with weight tend to be more endomorphs. These are more carbohydrate, sugar sensitive people. And your ectomorphs, they don't have any problems. They metabolize the carbs and sugars pretty easily and actually need that more to keep going and don't have the problems like the endomorphs will. You get with a good personal trainer or whatnot, they'll inform you on things like this. Myth 16, if you exercise enough, you don't have to count your calories here. Talk about that briefly there. To get with a good personal trainer to maximize results and to achieve and set realistic goals. It's as simple as that when it comes to that here. Food allergies can't make me gain weight. That's false. Leaky gut problems can lead to food allergies, which can cause an increase in your cortisol and gut inflammation there, and then lead to the weight gain with the cortisol problems there. What causes leaky gut issues? Overuse of antibiotics, low fiber, high sugar diets there, overuse of medications and NSAIDs, microbes, GMO foods, all these things cross your gut line and then gets in your bloodstream. You build antigens to it. Then when you eat the food, these antigens attack your gut, create this inflammation in your gut. You got this inflamed gut going on. Then the cortisol goes up. Then the weight follows that there. One of the books that really explains that there is the Virgin Diet book there, J.J. Virgin. She cuts out the top 7 sensitivities that people have, cuts them all out for a month there, and then she slowly introduces them back there. We run food sensitivities at our office here, and we check for the gluten, the casein, nuts, seeds, almonds, and different things there. And we like to heal the gut there using probiotics. The definition of a food allergen is an undigested protein. You need acid to digest your protein, so hydrochloric acid production is absolutely huge. And a lot of people have dead digestion today because they're on all these acid blocking medications, Nexium, Paracet, Tums, Tagamet, Protonix. All this food's rotting in your stomach and going south and creating issues here. You need more acid to digest those things there. I could spot reduce my problem areas. Spot reduction is not possible unless you go for liposuction. Without such surgery, your body will draw fat from different regions and at different rates depending on your genetic makeup there. And your stomach's one of the last areas where it draws fat from there, so that's why people tend to have the issue with the stomach here. I like circuit training here. This is just kind of on one machine here. When you go to the gym and there's different machines there, kind of getting a good workout with a lift as well as doing a cardio at the same time. You keep your heart rate in the target zone there. And it's kind of like interval training where you go hard for a minute, take a break, go to the next machine and kind of switch it up in that. It's pretty cool. I kind of get bored doing the same thing a lot. I like to change it up. The big things change. Tony Horton explains it the best. I'll show you a chart in a future slide here. Myth 19, you need to work out every day if you're serious about losing weight. Now this varies big time here. You need training plus recovery to get results. 2 days on, 1 day off seems to be perfect for most people. This varies. Obviously this is a huge variable here. This isn't everyone here. Overtraining could actually cause injury with a lot of people and even make you weaker in the long run there. I see a lot of people, not a lot of people, but there's individuals that overtrain too much and they drive their immune system into a ground and they're constantly sick all the time. Myth 20, machines are better. Machines only base programs that train your body in a single linear motion. Truth. These one-dimension forms of exercise make you more susceptible to injury. Think about it. If we live in a multi-dimensional world, doing things like squats and more multi-dimensional workouts is more reasonable here. Now, change, muscle confusion, changing your workouts, constantly changing things here is how you break your platforms. Now, the people who give up after their New Year's resolution after this month do the same workout and don't change it, and about time January, February, March hit, they see no results there and they kind of give up from there. Got to change your workout. Healthy on the outside equals healthy on the inside. That's called denial. Many symptoms, deficiencies, toxins, and diseases are silent. They show nothing on the surface or don't have initial warning signs. You can never know if your organs are healthy or if your bones are strong enough unless you do the right test. These are the panels I run with my patients if you want to address your health, your weight, and your fitness. Come to the office, set something up, we could address your goals. Your desire to change must be greater than your desire to stay the same. I can't help you if you don't want to help yourself. Obamacare, what have we learned? It's been a few weeks since this Affordable Health Care Act's been open, and we found out the Affordable Health Care Act really isn't an Affordable Health Care Act. Your health is what you invest in yourself, not what your insurance covers, period. It's going to be a nightmare. I don't even want to jump into it, kind of cut with time here anyways. My previous lectures on YouTube, you could find there if you go to our website and click the YouTube logo, it brings you right to our YouTube page anyways. I gotta give credit to Aaron Mayberry and his wife. Our quality of our lectures are phenomenal there. They do a lot of wedding stuff. If you ever need any additional photography or weddings related stuff, ask them. This is their website here. Check them out. Very awesome there. Every athlete's got a great chiropractor behind the scenes. Period. Optimal function through a great adjustment. I treat a lot of athletes. Every athlete's got a chiropractor behind the scenes there. Period. A body in motion wants to stay in motion. A body at rest seeks more rest. Just because it's wintertime doesn't mean you sit on the couch more. You explore and do more things. This is where you'll find me on the mountains of Michigan here. And I'm a snowboarder from Metro Detroit here because I dress up like I'm going to rob a bank before I go out. Tried something new last year. I got to get back out there this year and do it here. Ice climb. This place is up in Fenton. Peabody ice climbing here. Rent some gear. Try something new. Climb an ice mountain. That is a complete body workout. That was pretty fun here. Make an office visit. Get our protocols and customize something for you. I've got the little handouts here. Discounted first visit price thing here if you guys are interested. Take some for your friends. Help someone out. There's someone out there you know that needs our help. Online ordering, go to our website. Orders over $125 is free shipping there. And thank you guys for coming out. I wish I had extra time to go over with you with questions, but the weather really delayed that here tonight because normally I'll give you an extra 10-15 minutes here. Thanks.